She's the first for Baptists in the Mid-South, and she's already making a difference in children's lives. Joining us is Dr. Fawn Lewis, a pediatric general surgeon with Baptist Medical Group. Thank you, Dr. Lewis, for being here today.
Thank you.
Now, you are a pediatric general surgeon and also, I understand, do some thoracic chest work as well.
Yes.
What are some of the common procedures that you do in pediatrics? The
most common procedures that we do are more simple. They're umbilical hernias, inguinal hernias, pyloric stenosis. People will come with children, want to maybe evaluate a birthmark or something of concern. Common things are common. However, really the more acute or more emergency things are things that we typically specialize in, like blockages of the intestine in little premature babies, or problems when babies are throwing up and cannot eat and drink properly.
Well, let me talk to you about that for a second, because this is something I've had patients ask me about as well. And this is always a major concern because parents are aware of pyloric stenosis, which is a blockage in the stomach that children are born with, and sometimes you don't know that until they start throwing up. What are some of the signs and symptoms for parents to look for if a child should have that condition?
Well, the important thing is to talk with your primary care provider and your pediatricians about how your baby's doing, whether your baby is taking enough formula or enough milk, whether your baby's gaining weight appropriately. And any time a baby is constantly throwing up and not really seeming to take in enough, getting dehydrated, maybe not urinating as much as they should, any of those things can become very concerning very quickly, especially in a small child. So
now, if they're diagnosed with this condition, what do you do at surgery to fix this?
Fortunately, pyloric stenosis is a very relatively simple operation. The tricky part is diagnosing it and getting the patients to us so that we can fix it. But after a baby is well hydrated and the electrolytes, the chemicals in their blood are corrected, it's a really short, simple operation to open that muscle and allow the food to pass through and allow the baby to get better.
So the parents need to realize this is something that's fixable and their baby's going to do okay.
Yes.
Now, you mentioned emergencies, and I know being a new grandparent is kind of learning things all over again about when to panic and when not. What are some of the things that parents should look for in their children, if their children are sick, that, hey, it's time to go to the emergency room? What are a couple of guidelines that they could follow?
A good rule of thumb is always when something is not progressing or improving as expected. So children can get viruses or have an upset stomach where they throw up, but those things usually recover or go away pretty rapidly. And so when a child or a baby continues to throw up or is throwing up more, not drinking well, and not really improving in the time frame or possibly getting worse than you expect, that's the time to really check in with your primary care provider, your pediatric specialist, or come to the emergency department to be evaluated so that we're able to say, well, no, this is okay and we need to follow it along, or perhaps do some tests and realize that, no, this is a different issue, it's an emergency, or it's something that is much more concerning and needs to be looked into more carefully.
Now, parents are always concerned about fever. Does fever always mean something really bad's going on?
Well, it's true that parents are concerned, and we always need to be careful because fever can be an important symptom of something that's bad. But the hard part is in children, frequently it's a cold, it's a virus, it's something that really is fairly simple and will go away, and that happens most commonly. But sometimes a fever is a symptom of something more severe, and so if the fever's too high, say over 101.5 degrees Fahrenheit, if the fever's not coming down or getting worse, that's a time to check with the emergency department or check with your pediatrician and make sure that everyone is comfortable with the current status or whether there's a recommendation to come in and have it looked into more carefully.
Well, great. And as Dr. Lewis would agree, if parents, if you have a question and you just don't know, goodness, it's never wrong to go ahead and take your baby in and get checked just to make sure that everything is okay. Well, thank you, Dr. Lewis. I really do appreciate you being here today on Health Matters. And we're so thankful for doctors like you who take care of our children and grandchildren, being a grandpa. Next, we'll meet a pediatrician to answer all of your questions about children's health. So stay with us. And in addition, I'm going to tell you the proper way to change a diaper. Now that is worth staying tuned in for.